Now, today marks World Brain Tumour Day. The day is observed annually on the 8th of June as a global initiative to raise awareness about brain tumours, their symptoms, treatment, as well as the importance of early detection. The theme for 2025, Brain Health for All Ages, underscores the need for vigilant brain care across all demographics, be it children, adults, as well as the elderly. For this discussion, let's extend a very warm welcome to the Chief Medical Officer at Life Healthcare, Dr. Karisha Quarrie, to help us further unpack and better understand this disease. Dr. Quarrie, what a pleasure. Good afternoon and welcome. So firstly, this theme perfectly aligns with the World Health Organization's vision of eliminating disability through early detection and comprehensive neurological care. It's a serious call to action to even do more awareness as well as education drives. But why is it of utmost importance to diagnose brain tumors at an early stage?
Good afternoon, Alicia, and to your viewers as well. And yes, it's extremely important that we have early detection and diagnosis of tumours, especially of brain tumour. And the reason for this is because brain tumours are in the seat of your cerebrum. They can have significant impact and cause significant disability if they are not detected. And what is important is that there are treatment options that are available to manage these conditions, and that's what we want to highlight during this important day and week.
Absolutely. Speaking of those treatment options, Doctor, let's go right ahead. And talk about some of the strides, firstly, in South Africa, in particular, marking brain tumor treatment, as well as the utilization of advanced technologies like ethos, while also focusing on the much needed research, Doctor, especially at the time where you saw there's been echoed calls this year specifically for the country, in fact, the African continent, to develop as well as sustain its very own research entities. So we saw how the reliance on international aid actually caught us almost unprepared, affecting a lot of such initiatives, Doctor.
Correct, Alicia. It's so important that we highlight the incidence of tumours. 20 million people are estimated to be diagnosed with a new kind of cancer this year, and almost 10 million people will die. So it is important that research and technology is available and that is utilized not only in the detection of cancer, but in the treatment of cancer. And Life Healthcare has made significant investment in the treatment space through some of the systems that we have in place in our facilities, Alicia.
Let's talk about some of those available treatment options, Doctor, that are also accessible to everyone, specifically in South Africa, because these types of surgeries as well as treatments are also unaffordable for those who don't necessarily have private health care. And as we move towards the implementation of the national health insurance as well, will such barriers, you think, Doctor, then be bridged, especially for the less fortunate? We were just reporting scores of surgeries that are actually backlogged at public facilities because of such high demand with limited resources as well as specialists.
Correct, Alicia. What's really important, and one of Life Healthcare's vision, is to ensure that we provide care that is precise and that is efficient, so that we can actually reduce the cost of care across the continuum of care for all patients that require this treatment. What we have put in place is real high-tech equipment, such as artificial intelligence, enhanced treatment systems, like you've mentioned, the ethos system, which actually adapts to the patient's needs on a real-time basis, allowing for there to be precise surgery so that the patient doesn't have to go back for further surgeries, that the tumor is treated for the first time and at the most accuracy. We also have stereotactic surgery, which is essentially high-dose focused radiation to the tumor itself, but preserving the normal tissue around the tumor. And in doing that, we enhance the accuracy of the treatment and we reduce the cost of care because the patient doesn't have to go back. And our third investment area is in our intraoperative magnetic resonance imaging, or IMRI. And this is actually where we scan the patient during their surgery to make sure that our surgeons have got all the tumor out And if they haven't, they can continue with the surgery. And ultimately, what all three of these technologies do is that they reduce the complication to the patient. They make sure that the surgeon is accurate and precise in the way he is administering surgery or radiotherapy. And this overall reduces the cost of care and improves the clinical outcomes for the patients.
Absolutely, doctor, because I suppose whether it's invasive or non-invasive, it's still quite high critical care when you're actually working around the brain. Now, there are some great developments, though, that need to be commended, Dr. Quarrie, like the University of Pretoria, for example, collaborating with the Pan-African Cancer Research Institute to identify genome-specific molecular biomarkers for brain tumors. And I suppose the significance here, doctor, is the specialized focus on those African demographics that I actually spoke about in my intro, and also creating specialized care. I'm not sure if you were listening to the package preceding our discussion as well about that identified type of cancer that is specific to Black women.
Absolutely, Alicia. It's so important to have collaborative care across the oncology or cancer space. And yes, breast cancer is a significant a concern within the South African healthcare environment. The majority of women who have a cancer have a breast cancer, and that's important for us and is actually part of our oncology strategy within Life Healthcare to address breast cancer specifically. And then when it comes to collaboration and research, that's also a very important component, ensuring that the centers that provide cancer care are accredited, like we've got all of our stereotactic facilities internationally accredited, so that the standard of care that we provide to patients is comparable internationally. So yes, collaboration and identification of key priorities in oncology is something that is important to us in Life Healthcare.
What a great conversation, Doctor. Thank you so much. We're going to have to leave it there. Unfortunately, that is, of course, the Chief Medical Officer at Life Healthcare there, Dr. Karisha Quarrie, there helping us unpack some strides made in brain tumors, as well as other neurological cancers.